Started.
Okay, it
So
should go through any second.
great. I'm multitasking here. So there it is. Okay, great. Let me just share it here. All right. We are live on Facebook. So awesome. Great stuff. Well, welcome everybody, whether you're joining us via Zoom or Facebook, or whether you're joining us on YouTube or GiveButter. I think those are all the platforms we have going. So first of all, thank you. A huge shout out to Solidarity Engineering for not only engineering at the border and beyond and making sure that you guys take care of all the wonderful people you take care of, but for engineering all of this tech because I couldn't figure it out and you guys did an amazing job. So thank you so much. I see some people joining us on the Zoom platform. Thank you guys for joining us. And those who are on the other platforms, feel free to chime in. I think we'll be monitoring as good as we can. So my name is Mark McDonald. I'm the executive director for Via Therese Clinic. I will let Erin introduce herself. Erin is the executive director of Solidarity Engineering, and then we're going to jump right into it because time flies. So go ahead and introduce yourself, Erin.
Yeah, I'm the executive director and co-founder of Solidarity Engineering. Um, I am an environmental engineer with my professional engineering license and started Solidarity in 2020 with two other engineers down at the US-Mexico border. Um, and yeah, so Solidarity Engineering, we're an organization that provides, oh man, we just changed our mission. So we provide life-saving infrastructure, essential supplies, and education to displaced and vulnerable communities at the border and beyond. Through engineering and creative problem solving, we address urgent public health needs. So that's me, and that's Solidarity Engineering.
Awesome.
Um, yeah.
Great. And with us here from our teams, I know we have Amy from Solidarity Engineering, and also I don't think we can see her, but Miranda is here as well. Miranda, thank you so much for all that you've done, and you as well, Amy. And then from my team here at Via Therese, we have Claire Lee, who is our development director, as well as my wonderful, wonderful helper. She definitely keeps me in line. So thank you, Claire Lee, for joining us. And Erin, I think what we'll do is I think we'll just jump into some questions and maybe open it up at the end to anybody who's watching. If they have any questions, we can certainly monitor all the platforms and see if we can answer some questions for them as well. But Erin, you and I have kind of what is it, 4 years now that we've known each other, 4 year
Yeah.
history. So I thought we could start by just kind of introducing how we know each other and how these organizations came together because it's kind of a unique partnership. We're definitely miles and miles apart, but the mission and what we do and how we plan to work together is so impactful to so many people. And for those of you just joining us, or those of you who are wondering what this is all about, we're calling this health, addressing health at the border and beyond. As you know, Solidarity Engineering is doing amazing work at the border, which Erin and her team will talk about. And Via Therese is a free clinic in the state of New Mexico providing care to uninsured, underinsured individuals. A lot of times that happens to be people of unknown migrant status or those who are undocumented. And so we serve a very overlapping population. So Erin, why don't you go ahead and tell us how Solidarity Engineering got started, the incredible work that you are doing down at the border, and a little bit of a history and an introduction on how we met each other.
Yeah, absolutely. Well, actually, Solidarity Engineering got started because I had heard a podcast, This American Life. It's like one of the most popular podcasts. Um, and it's actually the one episode, it's the first podcast episode that's ever gotten a Pulitzer Prize. It's called Oh man, I'm drawing a blank now, but essentially, a healthcare providing NGO was working at some of the migrant camps at the US Mexico border, right over the border. And this was right after some US policies had been instated that forced asylum seekers to remain in Mexico. Um, and so folks had kind of like accumulated in these camps. And in this podcast episode, a nurse volunteer is being interviewed, and she's kind of expressing her frustration that she keeps on seeing the same folks over and over again for the same preventable waterborne illnesses, right? They were getting diarrhea and skin infections and eye infections, week after week. And she kept on seeing these folks. And she realized that folks were um, drinking out of and bathing in the Rio Grande River downstream from where there was open defecation. So were no resources for these people. So there was no bathrooms. There was no drinking water provided to them. There was nothing. And this nurse was essentially saying, like, I don't know what I'm going to do. I guess I'm going to have to Google how to filter water. And I heard that I was working as a civil engineer in Philadelphia, and I was like, well, I know how to filter water. And my two co-founders from across the country, they also heard the same podcast, had the same reaction, contacted that healthcare providing organization, and they had essentially told us there's no engineers here. There's no one here to do this work, this preventable healthcare, because that's kind of what engineering is in these situations. And so I came down to the border, started working in these camps. My two co-founders came down um, and essentially got to work. We were using like GoFundMe's to fund ourselves, and depleted my entire savings to fund myself. Um, and then later that year, I met you, Mark. You came down at the end of 2020, right?
Correct. Yeah, at the height of
The
COVID.
height of COVID. Um, yeah, and you were working with that same healthcare organization.
Right. Yeah, so I came down to work for the healthcare organization. We had also arranged some political,
Yep.
some policy advocacy stuff. We won't get into that, but or at least I won't. But we linked up. I was initially volunteering as a paramedic. My background is in healthcare. I was volunteering as a paramedic for this healthcare organization inside the camp in Matamoros, and got to work really close with you guys. And then I became the project manager for the next 2 years, and for that healthcare organization. And over that time, it was really interesting to me to learn, or not learn, but to really realize just how important engineering and what you guys do really does determine a lot of health outcomes for these individuals. My health background is from the continental United States, mostly in New Mexico. And even though we're a really rural state, I realized just the deficiencies that were there on the border and how incredible of an impact that you guys were making and helping, as you say, in the preventative aspect of healthcare for the people who were in these camps. I used to joke when I was in Matamoros. I said, I really wish that I had the resources here in Matamoros that I had in New Mexico, which at the time that I was working in New Mexico, I was thinking, man, I really wish we had the resources that some of these larger, cities have. And then I moved to Matamoros and thought, man, I really wish I had the resources that I had back in New Mexico. And then to take it a step further, when I was in Sierra Leone, I thought, man, I really wish I had the resources I had in Matamoros. But the work that you guys do is so incredibly important to the prevention, to the preventative aspect of someone's health. And to really just see that come to life and the impact that you guys have is so important. So in looking at the relationship that we have now, when I took over as executive director here at Therese Free Clinic, Therese Catholic Clinic, I thought to myself, what is some of the most, or some of the more impactful partnerships that we can have when we look at who our demographics are that we serve, and how can we also coordinate with those like yourself who are working on the front lines at the border and elsewhere to really change some of the health outcomes for those who are most vulnerable. So I think this is a really interesting partnership. I'm so excited about it. I think the history that we have really makes us unique, and is something that I'm really excited about. Aaron, I have a couple of quick questions for you, and I know you have some for me as well, but if you don't mind, I want to start by asking you some questions. The first one is, if you can just explain to me how your WASH initiatives, if you can explain what WASH is as well, for those who don't know, how your WASH initiatives directly impact the health and well-being of asylum seekers and those who are stuck at the border, because we know that that problem hasn't
Yeah.
resolved. People still stuck at the border. So please take it away.
Absolutely. So, Solidarity Engineering, we work in several camps and shelters at the US-Mexico border, right in Mexico. Um, so, WASH is a term in the humanitarian field. It stands for water, sanitation, and hygiene. They all kind of fit together. And so, Solidarity Engineering, we provide clean potable and non-potable water. So water to drink, and then also water to bathe, to clean. Um, we provide sanitation. So we build bathrooms where we can. That's toilets and sinks and laundry stations. Um, we, in some locations where we can't actually build facilities, we provide porta potties and more temporary facilities. And then on the hygiene side of things, we get a lot of donations in for soap, for diapers, for hand sanitizer, for shampoo, anything that you use to like keep you clean and healthy. We provide that to the asylum seekers. Um, so there's hundreds of people, sometimes there can be thousands of people living in these really inhumane conditions. Um, really close together. There will be like multiple people to small tents, and just providing them the most basic of human needs, right? A functional toilet or a bar of soap, a shower, can really make someone like feel human again after being on the migrant trail, or just traveling with their family. So WASH is just one aspect of the work that we do. But we also do infrastructure work. So, we've done flood control measures and we've done shelter projects. We have a solar electricity project that I'm trying to get off the ground right now. Um, we do parks and playgrounds for the kids. We do STEM related educational programs. Um, Essentially, we really are the only engineers that are in this space. And so a lot of times the asylum seekers and migrants will ask us for help with certain things. And, if they tell us, their kids need a place to play, or they need a schoolhouse, or they need clean, functional, safe shower stalls. Um, Solidarity Engineering is one of the only groups that it works in these really dangerous locations. These camps and shelters are located in dangerous cities.
Yeah.
Uh, and so yeah, so we end up, I know it sounds like the breadth of our work is so wide, it's like water and STEM education and playgrounds and flood control, but um, when you're there on the ground and you just like see all these needs, it becomes
Well,
obvious that
yeah, and it reminds me of what we talk about so often in the United States, which is social determinants of health, and really that's what you
yes,
guys are addressing. And we recognize in a evolved healthcare system, we talk about these things all the time, how important health education is to health. A good education for a child is so important to someone's health. A good foundation, a place to sleep, a safe place to sleep, a clean place to sleep, a clean place to bathe, and to have safe drinking water. I mean, all of those things are so important. So you really are, you say it's broad work, but it is so important because those are the social determinants of someone's health. It's something that we're so adapted to and so unfamiliar with having. We struggle with that in certain communities inside the United States. And part of our job is to recognize that for our patients and our clients. But the majority of us don't think about those things. So you guys do cover a lot of aspects, but it is because each and every one of those things have such an important impact on someone's health. Now, jumping a little bit, we know that about 50% of the asylum seekers that you serve are children, which is an incredible statistic. And I remember when I was in the camp in Matamoros, when you guys opened the playground, and what a moving thing that was. And watching some of the children that would come into our clinic, how happy they were, to have that play place, which is again something that we don't even think about oftentimes in the United States, how important that is or how that can affect someone's health. But I remember watching health outcomes just in general sickness for these children's, how a safe play place actually improved the health for these children. So we know that about 50% of the asylum seekers that you serve are children. How do your STEM education, and you can explain what STEM is for those of us who don't necessarily know, how does the STEM education and play programs address their unique needs?
Yeah. So STEM stands for science, technology, engineering, and math. And so we teach a weekly class for the kids. And then our play programs, we've done 2 big playgrounds now. We've designed and constructed them. And right now we're in the midst of, we have the design for one of our for another big park. So with a playground and a green space. And we're just waiting to get approval so we can actually get to construction on that. And these programs are huge for the kids, right? So there's nothing else for them in these locations. One of the biggest shelters that we work at is called Senda de Vida 2. And right now it's home to hundreds of people, but it has a capacity for like over almost 3,000. And that we have seen that many people there in the past. And so, when 50% of this population is children, and there's nothing there for them. There's no school for them. Their schooling has gotten disrupted. There's they've been taken away from their families a lot of times, like they might be traveling with like one adult. So giving them a place, like a playground that's just for them, right? That they can go, they can be safe, they can play out scenarios with other kids. When we first got into building our first playground, I did a lot of research into how play affects health.
Yeah.
And the UN has actually sanctioned play as like a human necessity for
Yeah.
children. It's just as high up there as water and food and
Yeah.
shelter, which, as an engineer, I didn't realize that
Sure.
for the longest time. And then, and then when the asylum seekers come to you and they're like, we need a place for our kids to go. They're acting out their mental health affects physical health.
Yeah.
Um, and so, yeah, so providing these programs and then additionally having a STEM class for the kids every week has been like just incredible for our team to be teaching. Our teachers love it, look forward to the STEM class every week. The kids come up to them throughout the week being like, hey, are we doing our science class today? Is it today? Is it today? And they're like, no, we have to wait until Friday. Um, and the kids, my staff has started like giving them homework, like to learn like the multiplication tables because the kids just like are like, well,
Crave it.
what are
They
we going
crave
to do
it.
today? Yeah. And so they're like, learn this and, come back to me. And the kids love it. And yeah, you don't realize it until you see it right in front of you, like the benefits that
Yeah.
these programs are having.
Well, I remember, and don't mean to cut you off, but I
Oh
remember
yeah.
when I was in the camp in Matamoros, the school that was there, it was the same effect, and I attended several classes and several days. And
Yeah.
you're right, the children they need that, they want that, and it's almost like the human body is adapted to wanting those things because the human body wants to be healthy, right? And so. Um, it's a really unique connection that education that this what you guys are providing, how it really does support not only a child's health but a parent's health, right? Because
Yeah.
if a child is sick, that could spread to an adult, and then you have sick parents as well. So healthy children is healthy families, and so I think that that's such an important approach, and I appreciate what you guys are doing. One of the things that I find so interesting, I'm trying to, keep it flowing here. One of the things that I find so inspiring and so awesome about your organization is that I know this because the three founders of your organizations are friends of mine because of the work relationship that we had. Your organization is women founded and women led, and I love that. I think that that's incredible, and has been from the very beginning. And I think that that is so transformational, particularly for the space that you guys work in, right? It's not just it's not downtown Santa Fe that you're working in. It's on the border. And so it is a different environment, it's a different atmosphere. So the fact that you guys are women led, women founded is so encouraging. How does that influence your approach to humanitarian engineering? Because I think that that is such a unique space. Especially in addressing the needs of women and girls in the camp, because a lot of the statistics that you've shared in your emails address, the hygiene for women and the importance of that. So tell me a little bit about your approach as being, a women-led and women-founded organization in this space that you operate in.
Yeah. Yeah. Well, I mean, WASH in general, water, sanitation, and hygiene, it is for everyone, but we do tailor a lot of this towards adapting these facilities for the needs of like women and children, right? And this could be as simple as like putting a changing table in the bathroom. And we also have like a big overarching program right now, our women's health initiatives, which actually I'm going to tag in Amy, who we have right now. She is actually our project manager for the women's health initiatives. And she can talk a little bit more about what what we've accomplished with that project and what our future goals are with that project. So I'm passing it to you, Amy.
Yeah, totally. Thanks, Erin. And hi, everyone. It's so fun to be a part of this meeting. Just to give you a brief synopsis of our women's health program, typically in low resource settings, menstrual health needs are neglected. They're not recognized as a top priority. So the work that we do is trying to understand how we can elevate menstrual health needs to the same priority level as access to clean water, access to important wash infrastructure, et cetera, et cetera. So one of our kind of goals is to make sure that with any project we implement, we're always evaluating it from its conception, its implementation, and even afterwards through impact assessments. Um, and we love the ways that we do our projects are first through knowledge translation, and this looks like a lot of menstrual health education opportunities, workshops for women to come, be engaged, learn more about menstrual health tools and resources to help manage their cycle while they're living in displacement in these low resource settings. So that's the first part, fostering knowledge translation. The second part is helping inspire a collaborative effort to improve the well-being of displaced menstruators. And this looks like partnering with different companies and organizations around the world to either donate products that can be compiled into these menstrual health kits. They're like critical hygiene kits that include some of the things Erin talked about, soap, deodorants, but then we also throw in menstrual health products cater to the specific needs of women and girls who are living in these refugee shelters and camps. And we're always trying to think about new and fun ways to implement different programs that are always based off kind of like community surveys and assessments. So I have a few ideas that are coming up, and so maybe you'll hear more about them through our website, through our Instagram, and places like that.
Yeah.
Well, great. And thank you, Amy.
Thanks,
And thank you
Amy.
for, yeah. And this, I don't think this will be the last time that we talk about these issues. So I can't wait to hear more.
Yeah, totally. All
Aaron,
right, Mark,
on
I
the,
want to put you in the hot seat for a minute.
oh, goodness. Okay.
Yeah. All right. Um, I want to talk about the community that you serve and who these people are. Um, because I see them at the border, but you see them after they become part of our American community, right?
Yeah, absolutely. So a little bit of background about Via Therese. It's actually been around since 1937. Via Therese is the only free clinic in the state of New Mexico. So there is no other option for free healthcare in the state of New Mexico. I became the executive director in June, and the organization has been around since 1937. It was initially founded by Archbishop Gherkin here in Santa Fe and the Sisters of Loretto. So it has an incredible history. Um, we provide, like I said, completely free services. We're a 501c3 organization, and our focus is providing healthcare to those who are the most underserved. So our patients are typically uninsured, underinsured, and a lot of times these folks are of unknown migrant status. One of the unique things about Via Therese Clinic is that we have a compassionate, no questions asked policy, which means if you walk into our clinic, we're going to provide you care with no questions asked. There are questions that we have to ask, obviously demographics and health information, but we don't ask or discriminate based on your age, your gender, work status, insurance status, immigration status, religious affiliation. Our job is to provide health care to those who need it. We really believe that if you walk through our doors, there's a reason why you walked through our doors, and we're here to provide you that care. Our clinic runs medical clinics, dental clinics, and vision clinics, which means that we take a whole comprehensive look at a person's health, and we say, we'll help you with your medical conditions, whether it's urgent or chronic. We're going to help you with your dental care, and we also help people with their vision care. And so any of the services that we provide are free to all of our clients. Our population or the demographic that we focus on, as I said, are mostly underinsured or uninsured individuals. What's really interesting, Aaron, and what we've seen over the last couple of months is not only does this mean that we're serving oftentimes migrants or those who have undocumented or unknown documented status. What we've noticed is that those who were previously vulnerable are what I call super vulnerable, which means that they've moved from being kind of vulnerable or really vulnerable to being super vulnerable in the healthcare system. Those who were once comfortable, maybe they had health insurance or maybe they had Medicare, Medicaid. A lot of those people are now going from a comfortable status to being vulnerable. We see this with people who have private insurance because they can't afford their copay or their deductible. And so they're putting off going to the doctor. They're putting off those vision visits. They're putting off their dental visits. And so our job is really to focus on anybody who needs services who can't get them anywhere else. No questions asked. We're going to provide you the medical care that we can up to a capacity, right? We have a certain capacity that we can care for, but our job is to make sure that those individuals receive the health care that they need.
That's amazing, Mark. That's like so inspiring. What are some goals that you guys have for like the next year? Do you have any big goals?
Excuse me. We do. We have lots of big goals, and I'll have Clara Lee chime in just a second because she's our development director. But as executive director, I've taken a look at kind of where we stand as a clinic, who our demographic is, how that's expanding, and what we can do for them. One thing that we recognize, and one of the most urgent needs, is recognizing that a lot of times the individuals that we serve can't come in to our clinic during regular clinic hours, right? Because they super rely on their jobs. And a lot of times their jobs aren't flexible to allow them to make their appointments. So if we're running clinic from 8 to 5, they're not able to make their appointments because their employers don't let them. So some of our goals are transforming our clinic from what it is now to being more accessible and promoting that equitable access to this quality healthcare. So what does that mean? That means that we're looking to expand our hours to after hours. We're also looking to expand to being a walk-in clinic so that we can address people's needs. One of the things that's so interesting is we know that over 80% of ER visits in the state of New Mexico, and probably nationally, we're focused on the state of New Mexico right now until we conquer the whole world. But we know that over 80% of the ER visits in the state of New Mexico are avoidable, which means that individuals, for whatever reason, are feeling like they go to the ER for something that can be treated outside of the ER because they don't have any other access to healthcare. So someone with a sore throat is going to the ER and oftentimes is going into debt because they don't know where else they can get healthcare. So our main goal over the next year, at least one of my main goals, is to help our local healthcare systems recognize that we can be that healthcare provider for these unnecessary ER visits. That helps drive down costs, not only for the patient, obviously, but for these other healthcare organizations as well. And it's typically better health outcomes for these individuals because the ERs are so overwhelmed. A lot of times these individuals don't receive the care that they need, not for lack of caring on the healthcare providers' parts, but because they are so overwhelmed. So we're hoping to transition into expanded hours and a walk-in clinic portion of our operation. Other big goals is recruiting more providers. So if you're watching this, you're in New Mexico and you want to help us provide care, there is an immense need for the services that we provide. Clara Lee, what are some other goals that we have?
Well, we recognize that one of the barriers for any type of healthcare is also transportation. So one of the things we would really like to do in 2025 is sort of kickstart, if you will, and develop a program that we can go out and do some type of primary medical care remote clinics, whether that's just taking blood pressure or we talked about doing some skin biopsies. There are all kinds of things that we could do in a public setting that would give the patient an idea of how they need to proceed, whether it's coming to our physical clinic or it's something the doctor can help them with right there on the ground. So having a beautiful clinic, and Via Therese's clinic it's really amazing. It's very state of the art for a free clinic. It's truly fantastic. But if you can't get there, then you're still in need. So Mark and I have talked a lot about how do we do Via Therese on the go? Is that getting a vehicle so we can assist with transportation to our physical clinic, and or do we do more remote clinics where we're going to community partners and trying to do our primary care clinics there, or all of the above? So I think Mark and I both have big goals, and we want to accomplish them as quickly as possible. We want to see this model go throughout New Mexico and beyond. So yeah, we know where we know what we need to do. It's just a matter, of course, raising the money, getting the ability to offer these services, getting vehicles, getting more providers, as Mark said. But I'm pretty confident that we're going to do it. I think we will.
That's
Yep.
amazing, Clara Lee. So I do want to, like Mark and I talked, we do want to open it up to any of our viewers. If any of you guys have any questions for us, you can raise your hand in the Zoom, or on the Facebook Live. I think you can type in your questions. And while people kind of get their questions in or decide to chime in, I just want to ask Mark one more question. And how do you think partnering with Solidarity Engineering is going to help the Via Therese patients?
Yeah, well, I think our individual partnership obviously has its benefits, but I think we have to look at it from a bigger perspective, right? And I think that our relationship is a model for relationships that should be started with organizations abroad. What I mean by that is when you look at the work that you do, how it affects the work that we do is really significant. And when I was in Mexico, we talked about this a lot. And we said, man, if we didn't have all the barriers of continuity of care, we really could decrease the cost and increase patient outcomes if we created a system like your organization and our organization is creating. So what does that look like, and how can we be a model, and what does this partnership benefit? Think about the fact that if an immigrant starts, let's just start at the Tapachula, Guatemala-Mexico border, okay, and we're able to do, or an organization, a healthcare organization is able to do a health assessment of an individual in Tapachula. And let's say this individual has diabetes, and they're able to diagnose that or re-diagnose that and start an effective treatment for that patient in Tapachula. Imagine if that patient then migrated to all through Mexico to the US-Mexico border, where you make contact with them, you're providing sanitation, hygiene, clean water, you're partnering with other healthcare organizations who continue that care for that patient, so that when they do become part of our American community or the communities that we serve as free clinics or other clinics who are going to provide care to this individual, that patient has already been managed and is coming to us in a healthier state than if they didn't have those resources. We know that continuity of care is one of the best ways to drive down costs in the healthcare industry in the United States. Continuity of care is so crucial to making sure that costs are driven down. And so having a partnership with you and other organizations on the border, when those individuals get to our clinic, we know that they're managed. You can share their records from the border with us with the patient's permission, of course. We know that they're going to come to us in a much better state than if they didn't have those resources. I think that that's probably the most important thing, because it not only, the cost is one thing, right? It helps drive down the cost for the patient themselves and the healthcare industry in the United States. But more importantly, and most importantly, it means that that patient is getting that care, whether it's direct hands-on patient care or the addressing of all of those social determinants of health from beginning to end. And I think that increases a patient's health outcome in an immeasurable way that we don't see right now, because there isn't that continuity of care. So I think the model that we're providing and the words that we're using, healthcare at the border and beyond, it goes both ways. It's beyond you guys to the south and beyond you guys to the north. And so I think that I think that that's probably one of the most important things. Um, uh, but beyond that, I think that creating the community, the network of supporters is also tremendously important. And that's what really inspires me about this relationship as well. You guys have such a wonderful base and a wonderful connection of so many people who support the work that you do, who are in tune and realize the importance of your work. It's really important for them to know that there are individuals inside the United States who want to continue that work. When I left Mexico, I thought, man, if I could just do this work inside the United States when I go home, I would really love that. And I think that Via Therese is the perfect example of an extension of the work that gets done at the border by so many wonderful organizations like yourself. So the connection of your community and our community and how we pair up together and team up together really makes that connection and that model come to fruition.
Yeah, I love that. Yeah, being able to talk to the asylum seekers and the migrants at the border, and knowing that, a lot of them do feel like abandoned, and when they cross into the United States, they don't know where to go or what to do, and knowing that if I'm talking to someone who's on their way to New Mexico and I can be like, look, Via Therese is the place that you need to go if you need healthcare.
Right.
It's
Yeah.
gonna be huge. Yeah. So
Yeah. Erin, what is one of the biggest challenges you faced in implementing your projects? I'm really interested about that because I know what they kind of were when I was there because we talked about them
yeah,
for
all
many
the
of them.
time. All the time.
But what are some of the biggest challenges you faced and how do you overcome them? How have you overcome them?
Oh man. What are the challenges that we face, Miranda and Amy? Everything. Um, our number one like stopper is always funding, right? That's always the thing that's gonna limit what we can do. Um, so funding some of the projects we have to work with the municipality and get like approval on. So, right now we're waiting on approval from some of the government agencies to build a park at one of the shelters, and we've been waiting for the past 5 months, I think. And we have this beautiful design done, and we're just kind of sitting there waiting. Um, our the I don't know how deep I want to go into to this one, but the organized crime in this region is very has a very major presence. And so we have to work around and deal with kind of the dangers associated with the cartels. The cities of Reynosa and Matamoros are some of the most dangerous cities in the world. And the state of Tamaulipas is where they're located, is considered a Category 4 do not travel by the U.S. State Department. Um, so that's something to consider. And then crossing supplies, but we have a ton of donations on the Texas side of the border that we have to cross into Mexico. And so paying taxes on that or somehow getting around that and having construction materials and stuff, which I'm just expecting crossing the border to become even more challenging in the future, and crossing with supplies to become even more challenging. So yeah, so there's just challenge after challenge after challenge here. But when we do the best we can with what we have. So yeah, that's kind of where we're at with our challenges. What are some challenges that you guys deal with?
Well, I think you said the big one that all nonprofits struggle with, which is funding. It's an interesting space, nonprofit world. I think we can all agree on that. And I think that, funding will always be, even if you get all the money in the world, you're not going to be able to do what you want to do, right? Because we want to do so much. But I think funding is a big challenge for us in 2025 and beyond because we have such a need. Some of the other challenges that we face, for our particular operation is the constant pull between we really want to promote our clinic and let people know we're there, which means traditional media sources, social media, but most importantly, word of mouth. When you weigh that with the risks of over advertising, particularly in this current and upcoming political environment, what that means for our patients, I think that that's the biggest challenge that we're looking at in 2025 because we see ourselves and our patients see us as a safe place to seek medical care. They know that when they come here, they're going to receive care without being asked any questions. If we, for example, put an advertisement in the newspaper, or we have an advertisement, a billboard, and it's more widely known that this is a place where people of undocumented status or unknown migration status come with the current political environment, we don't know what that means for our operation and the safety of our clients. So that really hinders patient recruitment. We know the need is there, but if you over advertise, your clients start to feel a little less safe. That's such a unique thing, and I can't believe that we have to think about that. But we do. And That's a huge challenge. It's a challenge that, unabashedly, I wish we weren't in and was not anticipating, hoping that we wouldn't have to face, but it is. And so that really complicates things. In addition to that, sorry, I know I talk a lot, but in addition to that, working with other healthcare organizations, more corporate-based healthcare organizations in the community, we recognize mutually that that's a struggle that is going to hinder good patient outcomes, because whether patients want to seek care with us or at an ER, they're going to put off healthcare because of the fear. And so we're anticipating an increase in expenses because people are going to be sicker, because they're going to put off healthcare because of the fear. So I think that that's just a unique and really interesting, a really perplexing position to be in the United States.
That's tough. Oh man. Do we want to open it up to questions from our viewers? Do we have any on Facebook or anything?
I don't see any on Facebook, but does anybody here on this meeting in Zoom have any questions?
We've got a me in the chat.
Feel free to unmute yourself. Usario. Oh, translate. Okay. I think the question is in the
Is
chat.
donating. Yeah, you can donate to, that's like, great question. Love it. You can donate to Solidarity Engineering via our website, solidarityengineering.org. And I know via Therese has a donation option. And all of these donations go towards helping at Solidarity, they go towards helping folks at the border and doing disaster response work as well. So Mark, I don't know if you want to plug.
Yeah, absolutely. All of our donations go to direct patient care. So if you donate to our organization, our main focus is making sure that patients get care. For example, we just released some data, and I apologize. When I sent you guys some data, I made a typo, so I want to correct it for the record. It's my fault. We did our dashboard for the month of November. And in the month of November, October and November, we provided over $13,000 worth of dental procedures and dental care to our patients. We provided over $20,000 worth of medical and vision care. That's in 2 months. And we had over $30,000 worth of volunteer provider hours in those 2 months. So your donations go directly towards providing our patients with the vision care they need. So our eye drops to dilate eyes so that we can get a good reading of what their vision problems are. Or it goes to silver diamine fluoride so that we can arrest decay on a child's tooth so that they don't have pain and they can keep their teeth. Or it goes towards filling material so we can fill a cavity. Those are the types of things that we know make a difference, and that's what your money goes towards.
That's huge. You guys are doing so much. Oh my gosh, over the past, all of that was over 2 months?
October and November. Yeah, in the newsletter, I said I had a typo. I said 23 months, but we did that over 2 months. So
Oh my God.
in 2 months, $13,000 worth of dental, $20,000 worth of medical and vision. And those are Medicaid reimbursement rates. And so, and another interesting statistic, the $13,000 worth of dental care is Medicaid reimbursement rates. But on top of that, we were really only doing in our first 2 months of dental clinics x-rays, exams, that sort of thing. As we start doing more procedures like extractions, fillings, silver diamine fluoride, those numbers are going to skyrocket. Our first 2 months of dental clinics, we had 12 scheduled dental clinics and we saw over 70 patients. So
Wow.
is definitely incredible.
That's incredible. Yeah, that's crazy. And not for nothing, but at the border we're providing toothbrushes and toothpaste and clean water for folks to actually brush their teeth. So
That's
Uh,
amazing.
you know, not any crazy procedures, but this could potentially a toothbrush and toothpaste and clean water to brush your teeth definitely helps prevent um
Absolutely.
these for people's teeth to get that bad
Yeah.
to thousands of dollars worth of dental work.
Absolutely. And the mouth is such an important part of someone's
Yeah.
overall health. If you have cavities, if you have dental issues, gingivitis, perio, all of those things affect your overall health. So it's so important to address those things. So you need some toothbrushes and toothpaste, we can send them your way.
Yeah. Love it.
Awesome. I saw another question in the chat about how you can volunteer. I'll take this one first, Aaron, and then I'll shoot it over to
Yeah.
you. With our organization, you walk in the door and you tell us you want to volunteer, and we'll find a place to plug you in. You fill out a quick application just so we have some demographics and some emergency contact information. But whatever your specialty is, if you're a graphic designer, maybe you want to do public relations, maybe you want to help us with fundraising. If you're a healthcare provider, you want to help us take blood pressures, you're a dentist, you're a dental hygienist, and you want to provide services, we will find a place for you because everyone is welcome. So it's really simple with us.
That's incredible. Yeah. That's Solidarity. We have on our website, if you go to www.solidarityengineering.org/get involved, get-involved, or just go to the website and you'll see where you can get involved and volunteer. And just you fill out the form, and most likely it'll be me who answers you. Amy was our volunteer coordinator and project manager for the women's health, but she's leaving us soon. So but yeah, so yeah, that's, and if we have work remote, we have work in person. Yeah, just keep in mind our in-person work is in Reynosa and Matamoros, which is not everybody's cup of tea. So yeah,
I
but always
remember.
looking for volunteers, always.
Yeah, same here.
Yeah.
I just
Other
put the
questions?
links for getting involved and submitting the volunteer forms in our chat box, both for Solidarity and via Therese
Awesome.
Clinic.
Thank you.
Amazing. Thanks, Amy.
Yeah. Does anybody else have any questions? If not, I think I have a couple of questions maybe for Amy and or maybe one question for Amy and one question for um,
Oh, actually, Tim Barry, Frog, you just unmuted yourself. I saw that.
oh, great.
Well, I was just going to introduce myself before the end of the call. Um, and so um, I've known Solidarity since the beginning. So I went down there to work with them at the very beginning of COVID. Um, I remember Erin told me she was from Pennsylvania. This was a long time ago, but it was the beginning of hurricane season. And I asked her if she knew about hurricanes in Texas and the fact that the the asylum seekers were living in the floodplain um, at the end of the Rio Grande River. So that was the first thing we did was get all the emergency agencies, and then I worked with them on I'm an architect, a retired architect, but so I've been working with the Solidarity team on and off over the years. But maybe this is what's interesting about this call, this Zoom, is whether it's cosmic forces or Saint Ignatius, I don't know, but I have just moved to New Mexico and Santa Fe.
Oh,
Um,
wow. Well, welcome.
What?
but it's kind of been a gradual thing because I'm a little still nomadic. But no, I bought a piece of land in Pecos and I got a little cabin I'm renting on the outside of Santa Fe. So I'm actually in Texas right now for health stuff and a bunch of medical things. But when I get back to New Mexico and after the holidays, I will get in touch with you all and come and visit you and see what I can do to help.
Oh,
Um,
That
and
sounds
then
incredible.
and
Thank
then
you. So,
Aaron, we haven't talked in so long.
Yeah.
And I've been out of touch. But if you all come, um, please come visit New Mexico, and we have plenty of places to stay.
Well, now that I have like a whole clan out in New Mexico, I feel like I need to come visit.
It's the new spot. And
Yeah.
Mr. Barry, you were there. The tail end of your visit was the very beginning of my
Yeah.
visit. I actually
Right.
remember. So it's so good to see you again.
Right. Well, and I was there a lot at the very beginning of COVID, and then I was a high risk person, so I couldn't spend a lot of time in the camps, and so I came back to visit a few times, but I haven't been down in a while. So, but thank you for all of your service, everyone, to our communities, and so we will keep doing the good work. But Mark and Clarilee, I will get back to you when I get back to New Mexico. Let's say after the beginning of the new year and the holidays. So,
Wonderful. Well, thank you and
and
bienvenido a Nuevo Mexico.
and I will put my contact information in the chat for you.
Yeah.
Awesome. Great. Thank you so
Thank
much.
you.
Yep. Oh,
Any other questions from the crowd?
I've got one for Amy. Amy, what has been the most impactful part? I'm so sorry you're leaving, by the way. You've been incredible to work with, so organized and so wonderful. What has been the most impactful part of being part of Solidarity for you?
Oh, that's a brilliant question, Mark. Thanks for asking it. I think for me personally, so I'm situated in Canada, and I was doing my master's in global health. Then I joined Solidarity recently, like just in May, as part of my practicum to complete my master's program. And global health is a program I've been wanting to take for years. I'm really interested in understanding the intersection of so many disciplines to promote, better health and well-being for communities in both the global north and global south. And so having been a Canadian, kind of like understanding and learning more about these dynamics at the US Mexico border has been not only fascinating, but it's also like helped me um, broaden my lens and my world perspective. And, being the States is like neighboring country, I'm just above y'all. Like I'm not too far away.
I feel like
Sometimes it
Amy
feels
sometimes
yeah.
Amy's like, are you guys doing okay down there? It's like, what are you guys doing down there?
It's a good question.
Yeah. Right. Sometimes I feel so far, but then I realize it just our world is so connected and there's so many opportunities to really learn and advocate and continue to like find ways to collaborate and support on different initiatives. So I'm grateful for the opportunity to have been a part of Solidarity and I'm excited to stay connected as a volunteer. So maybe I'll come to the clinic too in New Mexico. Who knows?
You always welcome. We got place for you to stay. Well, thank you for sharing that, Amy. I think that's wonderful. And I wish I got to meet you in person and maybe sometime soon we will. And again, thank you so much for your help. I've got one more question too for Miranda because, well, I've got two for Miranda. The first one is, can you show me how to be a tech guru? Because what you pulled off is amazing and I appreciate that. But the second one, the second question I have for you, Miranda, is looking forward to 2025, what's the most exciting project or the most exciting thing that you're looking forward to in 2025 with Solidarity? Hi, good to see you.
Yeah, sorry. Yeah, the tech like off screen here with like five screens going. But yeah, I'm Miranda. I'm programs director at Solidarity and the in-house IT person. So yeah, we're a team. You're looking at our team right now of like me, Amy, and Aaron doing all of the fundraising, all running the nonprofit, doing all of that type of work that just takes a lot of time. So thankful for their help. And this next year, we're actually doing a really unique project, our biggest one yet, that's going to help us really formalize our play program. So we do play STEAM classes in playgrounds, like Erin mentioned. And usually we do them in the camps and like in these protected areas that's only accessible to the asylum seekers. But this next year, right outside of Senda One, that's one of the shelters in Reynosa, we're doing a community play park outside of the walls. And it's going to kind of have its own little closed off section so that the kids in the local community can also be involved because it's a really hard area to work in. These kids, there's no schools. The kids also don't have playgrounds. And so, working in the shelters doing these big projects, it doesn't feel right unless you're, involving the local community. So that's a huge part of our work as well. So a lot of really exciting things that's going to help our organization grow naturally for sure. So we'll keep you updated, but
It's
yeah.
amazing. That's great.
Love that. I
Awesome.
think we're at time. Did anyone have any other like questions or anything?
Well, I can't leave Clara Lee out, so I've got to ask one more to Clara Lee. Clara Lee, other than having to deal with me every day, what has been the most challenging part of being part of this nonprofit? Because you have an incredible history of nonprofit work over, what is it, 35 years or something of working with
Yes.
nonprofits. So
Showing my age.
what makes Via Therese unique, and what is the most challenging part of being part of that?
I think you addressed it earlier. We want to make sure that the community that we're in knows that we're here, we're available. I spend what seems like a good part of my time in Santa Fe going to the men's shelter and just handing out pamphlets and talking to people. And I have a cat I take for a walk, and I run into unhoused individuals all the time. People want to come up and see the cat, and we talk about their situation, and I can hand out information. So it's getting the word out that we're here and available. And people wanting to feel safe about that. A gentleman that I handed a pamphlet to on the plaza a couple weeks ago called me. Um, he had my somehow had my card as well, and so he called me wanting to know, what he could do. And so I, of course, was able to give him Via Teresa's direct information, and hopefully he is now a patient. So I think that's one of the challenges that we have. And as you also addressed, funds. There's no nonprofit that I've ever worked for or with that was like, oh, we got plenty of money to do everything we want to do. That's never happened. Um, and that it's difficult. People, I believe, for the most part, are very good and very generous. But there's so many organizations that are doing great work, and a lot of them overlap, right? And so that's why partnerships like this are so important. Let's all work together to make sure that we can share the resources, even if that's not necessarily cash. If I have things that Solidarity needs, or vice versa, let's make sure that we get those things out to you. It doesn't do any good to have in-kind donations sitting in storage or on a shelf. They need to be out being used by people. And yes, so that's it as development director. And I just finished 3 months. That's been one of the that's been one of the challenges, is how do I balance making sure I'm doing development as we think of it, raising the money that we need to operate. But also, I look at this as development. I want to work with Mark in developing our ability to serve more people. That's what we're here to do. So, yeah, that's it.
Wonderful. Well, thank you, Claire Lee. And I know we're 4 minutes over or 3 minutes over. So I'm gonna just say one more time, Solidarity Engineering, from the get-go, the moment that I met you guys, I've just been a pure inspiration. I love working with you guys. I loved working with you on the border. I love working with you now. I think the work that you do is incredible. I think that your hearts are so pure and so passionate, and I just love that. And the people that you bring in to help you do that work is exemplary. We see that with Mr. Barry and so many other people. So thank you for the work that you do at the border and beyond. If you are wanting to support solidarity, solidarity, it's been a long day. If you want to support Solidarity Engineering, go to solidarityengineering.org. That's solidarityengineering.org, and make a donation today. I can't encourage you enough to do that. $5, $10, $1 million, whatever you have laying around, because they really are making an impact. And then the next time you feel like making a donation, you can come and make a donation to us. But I really think that the work that you guys are doing is incredible. And I really want to encourage people who are watching live, or maybe when we post this, please go to Solidarity Engineering and make a donation, because they're just an incredible organization and we love you guys. And thank you for joining us. And this is just the beginning of such a wonderful partnership, I think, and so such an important partnership. So thank you guys.